We're going to continue our team coverage here of the breaking news stories. Let's go out to UVM Medical Center for a press briefing right now.
One more day or a week. We've extensively planned for this type of event, and we're using those procedures now to make sure all of our patients are getting safe, high-quality care. I'll stop there. I want you to know that if there's any questions about the investigation, I'm going to have to refer those to our local and national law enforcement agencies. But I'm happy to answer questions about any patient care issues. And we have our incident commander here, Dawn LeBaron, who can tell you about this process we stood up yesterday for incident command. We have that in place 24 hours a day right now to deal with any issues that come up that we haven't accounted for. Thank you.
Dr. Leffler, I actually myself have an outpatient appointment in the medical center tomorrow afternoon. I take it I'll be in the process of notifying patients whose appointments might be affected right now. Any indication of about how many folks might be affected? Have any kind of handle on that, or how far out some of the affected appointments are?
So our patients should know that if you have not been contacted, you should expect to have your appointment tomorrow. We have been seeing patients today, both through, we have a way to do our telemedicine visits, have happened today. I know patients who have gotten those and they went well today, and we are doing in-person visits. They may feel a little different than usual, but your clinicians are there and ready to take care of you. They can write prescriptions, do exams, and all the normal things that you may need.
Are there any indication yet about how many appointments may be affected in all this, or that's something that
So that's evolving. So we had our surgeons and anesthesiologists come together this afternoon to confirm what cases could be done tomorrow, and we have our clinicians making those decisions. So I can't give you an exact number. It is impacting some people because we aren't quite as efficient as when we have the EMR. But people who are in urgent need of care are getting it, and most appointments are happening. Most surgeries will happen tomorrow. We did slow some down today as we were switching systems.
And if your appointment is affected,
you'll hear if your appointment's affected.
Could you speak to the type of cyber attack this was? What exactly happened to the system? What was affected and what happened?
I can't comment on that. The investigators will answer those questions for you. Right now, it was extensive, I can tell you that. It impacted many of our systems, and we are pretty much on full downtime procedures for most everything that we do, on paper for most everything.
What does it mean for COVID testing? A lot of people are getting coronavirus tests. Do they have to wait for results at this point?
So we are working with our partners at the state and the labs that we send these results to make sure people get results as quickly as possible. There may be a slight delay because one of the pieces isn't working normally, but we are fully focused on having testing still happen, and the Department of Health has been fantastic. Our external partners like Broad Institute have been helpful, so people will get their results. It may be a little delayed compared to normal.
Dr. Leffler, I think because the My Chart feature was affected, some patients may be wondering if their own personal records were targeted. Can you speak to that?
As soon as we knew something was happening yesterday, we shut down everything in the system, including all patient information. So at this point, we are still investigating what's been impacted. We have no information that any patient information has been impacted, but we are still doing that investigation. But I credit our IT team. As soon as we knew something was going on, they shut down many parts of the system to protect patient information.
What do you know that was impacted?
So right now, the way I think about it, and I'm the worst IT person ever, is connectivity. It's how all our systems talk to each other is the main issue. So it's as much about how the systems talk as anything else. And I don't know, Dawn, do you have more information than that?
No, I think that captures it at this point, and more details we probably wouldn't want to give at
Yeah.
this point. Like, so, but for us non-tech wizards, like what kind of, like you talked about, is this like about Epic? Is this about the host? Is this about the, patient portals? Or?
So we do not think this was directly related to being an Epic hospital, but we are carefully making sure that all the places where we come into patient contact are being carefully monitored. So we don't think it was due to Epic, being an Epic hospital.
You mentioned a little bit about the patient data. Is that data encrypted in your system already?
The data in our system is heavily protected, and I don't want to talk too much more about that because it's being investigated right now. The current information we have is that Epic data is safe right now.
So there's a number of hospitals that have been impacted across the country by similar sorts of instant attacks, and some of them have paid or said they've paid ransom to sort of deal with this issue. Has UVM Medical Center paid any money
I'm the president of the hospital. I've received no request for ransom. I've had no contact with anyone at this point, so I really can't comment on that.
Did UVM Medical Center or the health network lose any backed up information as a result of the attack?
At this point, we're still doing investigations on all of our systems, so it would be too early to tell you that.
What needs to happen to get the systems back in place?
So you're talking to a doctor, not an IT person. I want to be clear on that. So the first part of this work they're doing is isolating what happened, and they're working hard on that right now. Once they know what happened, they can trace it and then do the repair. And so that's really the three parts that have to happen, and they're in the beginning phases of that work right now. So we are planning to be down for more days. We don't think it's going to be over in hours. We're planning for more days, and we are well prepared to care for patients for as long as it takes to bring the system back up safely.
Are you concerned at all? I mean, we're starting to see COVID cases creeping up in Vermont. This is not exactly a great time to have this sort of issue happen with the largest hospital in the state.
What I want people to know is people here are trained to take care of patients. They know how to take care of patients, and we have tools such as an electronic medical record and things like that to help us. But the staff here is incredible. I rounded across the entire hospital today. Our staff was on it. They had full control. They were taking care of everybody. I was so proud of them.
John, do you mind swapping places? Sorry.
Not at all.
You are the incident commander for this.
Yes.
And so I know that it's your policy to have backup plans and contingency plans.
Right.
Have you prepared for the possibility of a ransomware attack? Is that something that was in your playbook?
Yes, thanks for that question. I think we do have a business continuity plan, which is the IT recovery plan or backup plan for an event such as this. We've had system outages before, obviously nothing to this scope and scale, but because we have had those systems failures before or down outages briefly, we have pretty good backup plans. So we test those and drill those. So the assumption is, yes, the electronic methodologies help us make our job easier and make communication better, but we always have a paper backup process for everything. And that doesn't really just apply to patient care systems, but I would say that's for facility systems, at building controls, security systems. We have each director, each leader's responsibility is to understand what would they do if this type of an event were to occur. Now, again, this is just like the pandemic and just like our preparedness before with influenza and other disease of high consequence. This pushes us to a higher level, but I can tell you that everybody is utilizing those plans, and we're thankful that we've had opportunities to drill them in the past.
You drilled specifically cyber attacks.
We've drilled IT network outages, which is really what this is.
Is the data backed up? Patient information, is that backed up? Somewhere you talk about having backup plans, but is the data, patient information, is that somewhere else?
Yeah, I mean, I think that that's part of the investigation in terms of fully answering that question. But yes, we have redundant systems, and we treat the information with the utmost concern and priority and privacy. So, that information is definitely like gold for us, and so we take care of it in that way.
And Jack had mentioned, he used the term ransomware. Would you guys call this a ransomware attack?
We don't have confirmation of that at all.
Do you know if it's associated with Ryuk at all?
We don't know that either. We are leaving that response to the federal authorities, and we certainly have those people very involved, and we will leave it to them to determine what's behind this. What we're focused on right now is that we have a large outage, and so what we know we need to do is deal with taking care of patients and making sure our staff can do that safely every day, and that's what we're focused on and working on. Our IT folks and the investigators are focused on what happened, how did it happen, why did it happen, and then move forward to a recovery process when that appears to be appropriate.
Have you and your IT people communicated with your counterparts at other hospitals that appear to have been attacked as well?
Those communications are happening. We certainly, there's a wide network of connections that happen from Dr. Brumstead to his colleagues, from Steve, Dr. Leffler, and others, to collect information and make sure that we have a good sense of what's going on in the world. But what we are really focused on is taking care of patients right now and making sure that we do that as smoothly and safely as possible. And we think, by all accounts, we're doing pretty well with that. Now, to say that it's like it was 2 days ago, absolutely not. It's very different, but like everything else, our staff feels confident, and they are focusing on what they need to do, and they're very encouraging in their feedback to us about, we got this. We're not taking that for granted, and we hope that we can work through this as soon as possible.
Can you talk a little bit about what was impacted at different hospitals, and like how the patient experience might be different at each one?
Well, I can't speak to the other hospital impact at this point. I mean, I can only talk about what we're doing here. I think it's different for if you're talking about the other hospitals in the network. I think given the size and the systems that everybody has, the impact is different. But for us, my job is to focus on the UVM Medical Center and the incident command process, and to make sure that we keep all of our resources focused right here, so that we can mitigate the situation as best as possible and basically take care of patients. That is happening.
Are there COVID testing sites closed in the other? I don't know if this is a better question for Dr. Leffler. Just trying to get a better scope on that. Are there other testing sites closed? Is Fanny Allen, is that also in operation?
Fanny Allen is in operation, that I can tell you.
And are COVID testing sites open?
Yes,
Yes.
definitely.
All the testing sites are open.
Yes.
Dr. Leffler, can you speak to the level 1 capabilities here? We were curious if Medical Center was able to accept really the most serious. We had heard that possibly there was consideration of diverting some of those cases to either Albany or to Dartmouth-Hitchcock. What's happening with that?
So yesterday afternoon, as we were trying to assess exactly what had been impacted here, our trauma surgeons made the decision yesterday afternoon that for the time being, we would accept local traumas. So if someone was in a terrible accident, came through our ED, they would manage those. But for other traumas, we accept a lot of transfers. That for yesterday and today, it'd be better to not have those come here as we work through the problems. So we called our partners, we talked to Dartmouth, we talked to Albany, CVPH was able to take some traumas, and we did not accept outside traumas. We're still not yet right now. But local traumas that came through our emergency department came in, got normal, high quality care, and went to the OR if that was necessary.
What is outside defined as?
Any place that doesn't come straight to our emergency department. So if they're transferred here from another department, anywhere. And we accept many of those in a week under normal circumstances. But our trauma partners in the region have been exceptionally helpful. They've called us and said, tell us what you need. And so out of abundance of caution, we have been having other hospitals take the transfers right now, but we're caring for our own.
You said you're expecting this to last a couple of days at the very least, if not longer. I mean, what's the sort of outside, like, if this goes on longer than a week, like, what considerations have to be made?
So the best way to think about this for the staff is if you think it's going to be done in an hour, you may do things a certain way. We're telling our staff, be prepared like it's going to be this way tomorrow. And then tomorrow we'll talk to them about the next day. So we're telling our staff, we don't think it's going to be done in hours, think in days. And because that makes everyone shift to the new way of doing paper documentation, and all those pieces are in place. I can't tell you how long it lasts. What I can tell you is I'm confident that we'll be able to provide high quality care for the duration.
I heard that part of how this happened may have been that St. Lawrence Health Systems was impacted, and something about the connection, like with labs or lab orders. Like, tell me about that.
We have no information at this time about how it happened. I'd be unable to answer any questions about that.
Okay. And who's doing this work? Have you hired any outside consultants or anything like that?
So our IT people are outstanding professionals. They started working on this yesterday afternoon. They worked through the night. They worked all day today. They are making progress. They'll be working hard this weekend. And as they identify pieces of the system that need other work, they're using outside agencies, the companies that we buy this technology from, to help us. And I know they're working collaboratively, and they're having meetings 4 times a day right now to keep us updated on where things at and what we should expect over the next 12 to 24 hours.
Can you just reiterate one more time what types of procedures cannot be happening right now? I know, for example, one hospital that was impacted in Oregon can't do some cancer treatments because of computer-based.
So we are still assessing everything. We did delay some procedures today as we made the shift to paper, and we'll be better able to answer that question fully after tomorrow. But our ORs are open. Anyone who needed urgent emergent care that came in through our ED would be able to get it. Right now, we're not doing elective x-rays. But beyond that, I can't really answer at this point because we're still really assessing what could be done safely. And we're bringing our clinicians together to help us make that decision.
And what's the, you said you're on paper records, but besides that, like, what is that decision based on?
For going to the OR, it's
Or for what procedures?
yes, it's do you have access to the blood bank? Are the right lab tests available? Can you get timely x-rays? Would you be able to do ultrasound if you need it? Would you get the results in a timely fashion? Are all the people that need to be connected by some tool available? So it's really the clinicians coming together and talking about, can we do this safely? And we rely on them, and they're being amazing professionals, and so I'm very confident that when they say we can do it, we can do it.
All right, if anybody wants an interview after, like off to the side or something, just let us know. We'll set it up. I feel like, we don't need to keep you all out here forever.
You've been listening to Dr. Stephen Loeffler, the president and CEO of UVM Medical Center, and Dawn LeBaron, vice president of the Health Network's Hospital Services. Their patient portal system is going to be down for several more days, they said, after a confirmed cyber attack. They can continue to care for patients. The Health Network IT department is working around the clock. Dr. Loeffler made reference to the fact that if you're looking at a timeline, they're really at the very beginning of trying to figure out what exactly happened. The IT department is working with help, outside help. Dr. Loeffler could not talk about the FBI involvement and their investigation. The FBI confirming this afternoon that they are involved in an investigation about what happened to the Health Network in this cyber attack.